Today's episode is brought to you by the Hippocratic Collective. Check out our shows and content at hippocratic-collective.com. Tony, it is such a pleasure to have you here today.
Yes, Frances Mei. I heard I was needed,
Yeah,
so
I
here
was
I
going
am.
to say, not trying to put too much pressure on you or our conversation today, but I've been looking forward to this, and I was thinking, Tony's going to heal me. Tony will fix this.
I'm not afraid of the pressure of healing our physicians. So let's get it. Tell me what's been going on.
Well,
That's what I need to know.
yeah, I want to pretend it hasn't been, but for those of you who don't know Tony Chin-Quee, he is really one of my great role models and a member of this club that, as far as I know, we're the only two members of it, which that's pretty cool. And it makes me think, okay, we got to get like outfits. We got to do matching outfits. We got to do the uniforms. But
Jackets, yeah, the whole thing.
he completed ENT residency, went into practice for 3 years at Kaiser, and then after that, at the conclusion of his contract, walked straight into the Grey's Anatomy internship, later into the residence writer's room. And
Mhm.
you just cannot keep this man down. His book, I Can't Save You, was on NPR's 11 Must Read Books of the Year a couple years ago.
Yeah, can't believe that. But apparently, people want to hear that stuff, and I mean that book really, it was the medical memoir that I never found before I went into medicine. The one where we talk about how messed up we all are, and just don't sugarcoat it. And I was just hoping that people would relate to it, and I guess some of us do.
It's very incredible, beautifully written. You know, it's great to, of course, connect with other surgeons. Like in our past lives now, we were surgeons, but um, I really respect where you are as an artist and professional now in this new era. So,
Much appreciated. But enough about me, Frances May. What's going on your end? That's what we got to get into. We got to talk about. Tell me a story.
I'm deflecting because I don't want to talk about it. Okay, just this week I announced that I am leaving medicine. I have
Hey.
woo, I know. Seriously. And like that's the appropriate response for me. Totally understandably. Like that's not always the case, but like for me, and I know Tony and I have been talking about this for years, but like it was a long time coming, and
Mhm.
it's a joyful thing for me. That being
Yeah.
said, the internet had some words about it. The internet was not overjoyed for me. We'll say it that way.
All right. All right. I'm familiar with the internet. There are several circles of trash from whence people tend to emerge. So I wanna know just the depths. Let's get to the depths of how trash people are and how free they feel to judge someone's journey and their freedom and happiness. I'd love to hear.
Yeah, especially when they've just seen like maybe the first 10 seconds of a 2-minute clip, and that's it.
Hmm.
That's all the little snippet of a narrative that some people get. I will say before we dive into our first segment, which is ex surgeon reads mean tweets, and I think that that will help us like open up the conversation. Like you'll see the same themes emerge, and I'm sure like even if we did a blind test right now and I was like, Tony, just write like what you think the 5 most common mean tweets are, like he could probably get pretty close. But
Mm,
it'll open up the conversation in a way that I think is important. And I will say, even before we jump into that, that like there has been support, there have been many kind messages, and I have felt more seen than I've ever felt in my life, in my career.
excellent.
Yeah, which means a lot. Like before we just get in here and we're like,
Yeah, yeah, yeah.
you know, scram, not, don't scram if you see me and if we connect and you're our people. But
Hmm.
certainly, okay, let's jump into it. This
Get them.
is
Let's do it.
okay. This is probably we're going to start off strong with my favorite one.
Okay.
Life as an Art commented, "You sound like my ex-wife. Who is supposed to support you? Are you married to someone who planned their life assuming you would contribute to the community as a doctor, and now you're deciding to what? Don't tell me. You want to be a writer." Life as an
That's it?
Art.
Oh,
That's it. That's
yeah.
yeah. I
No,
mean,
that's a
thankfully it doesn't go on.
okay. Um, yeah. So I just okay. These responses will probably feel they're going to be similar to each other. But okay, before I jump in, I want to know before I jump in your your response to these, because this isn't about them. This is about you. And if we're going to be here healing Frances May, I got to know where she is at before we address internet crazies.
Honestly, this one is a good one to start on because it is like so telling on himself that it made
Hmm.
it easier for me to be like, this feels like it's about you and like kind of between you and God, and I hope a qualified therapist. Like
Hmm.
I just I didn't take this one even too personally, although interestingly, of course, at the end when he's like, "Don't tell me you want to be a writer," I was like, he got me. Like, to an extent, it is funny because these things that some people think are insults, that's not an insult. I do want to be a writer. I don't know. What of it? Like, what's your take on this?
Yeah, I mean, I think just like you said, this is someone sharing more about themselves uh, than anything about you. This is something about you deciding to make a move that is best for you, for your emotional health, for your joy, brings out the people who lack all of those things in their lives. And the specificity with which he comes
Yeah.
at you makes me think, oh man, you wanted to be a writer too, huh? How'd that work out? Probably poorly. And like, we want to talk about partners. We want to talk about, as if this is a decision if you're like I know you're partnered, but if anybody, is in a partnership, as if this would be a decision that you don't make along with your partner and you don't talk about this stuff and know, where people are coming from. Um, that is just, I mean, it speaks to whatever partnership they do or do not have and the strength therein. I think when I walked away, um, yeah, it was something I knew I wanted to do. And it's not like my partner was going to say, no, don't do it, but it was a moment where we could really just be like, hey, okay, this is what you need to do. Then how do we do this together? That's it. Am I going to be making money for a while?
Yeah.
Unclear.
Yeah. Yeah. Yep.
So yeah, unclear. But my partner at the time, she was, you're like, all right, I will continue with my thing, my job, and like, wherever you need to go, we'll figure that out. Um, and then, of course, once I kind of found my footing, with I was started writing. I managed to find a job, which is like a needle in a haystack, but it was a blessing, and I was able to kind of get that going. And then I was able to return the favor to my wife because she wanted to get out of medicine too, and was just waiting. I was like, all right, I got this job. I can be wherever, do whatever. Time for the pendulum to swing back so that you can take your jump too, and so that's what we did, and that's how we ended up in England. But that's for me, that is just a massive strength of our partnership. And for someone to come out and make the assumption that you could be uh, letting down your partnership at in the nicest, that's the nicest
Yeah.
interpretation, but
Yeah.
just to
Right.
be betraying your partner by doing this, come on, bro. Like that's your stuff going on, like, clearly.
Totally. Yeah, I completely agree with you. And like again, this is specific to me. I think that what's so interesting is like now that we're in this space, now that we've opened the can of worms, Tony, every
Mm.
time I say something, people take great offense as if me saying, I don't want to be an ENT. It's not a good job for me.
Hmm.
They're like, holy how dare you, like being an ENT is the greatest part of my life. I'd be like, that's awesome, that's fine. There's a lot of
We,
other cool interesting jobs that I don't want, like
hmm.
astronaut, like skydiver for Red Bull. I don't know, I don't like height, like I just, it's not for me. That's not a comment on anyone else. So I just think that here's what's funny about the partnership component of it is that I truly believe my husband married me despite the fact that I was a doctor and I was a surgeon, because it brought out all of the worst qualities in me. It
Hmm.
made me miserable, and it must be miserable to live with a miserable person. So, like, there's just so many misreadings here and so many projections. Like, I definitely don't think that he was like, oh, amazing, I'm going to marry this, like, surgeon salary. He probably was like, I hope this leaves medicine for, like, all of our sakes.
I think anybody, and this speaks to, a lot of these tweets. I don't know. I'm sure it's a good mix of people who are and are not in medicine, but any partner of anyone in medicine, any doctor's partner, or nurse's partner, you know, um, how very much you did not get in that relationship for the lifestyle and for the money and
It's such
for
a
the
bad.
emotional availability. Like that's not that's not why you got into it. You got into it hopefully because you really love that person, because this life will test them, it will test you, it will test your union in ways
Yes,
that are
it will
so
test
uncomfortable
that
and
bond.
terrible. Woo, it's going to test that. Come on.
I know. Come on, grow up. Well, it's the perfect
Yeah,
segue because here we have a for sure doctor.
excellent.
At the age of 33, you have made poor decisions in your career. You could not have done an otolaryngology residency and been an attending doctor for long. Many people would love to have been in your position. I was an otolaryngologist for 44 years, and as you get older, you can still serve as a primary care physician. I'm sorry that you feel this way. No one pried the scalpel from my hands, by the way. Somebody pry the phone from this old man's hands.
Yeah, this is a pretty old guy. This is like Facebook age sort of person. I'm surprised he made it on to
I don't know how he got
Twitter or
onto
TikTok or what have
Instagram.
you. Yeah,
What's
I don't know who taught. I don't see you. That's the issue with teaching
stop
your
teaching them.
elders to get uh, more involved with the social media and teach them hashtags and how to like get to people via the DMs. I don't like that. I don't like that. They like keep it on the Facebook. We know you're there creeping everybody out.
Yeah,
Let's leave it there. I don't need that in my life.
I agree. And for anyone who's seen The Office, Creed has like his Creed Thoughts blog, which is just a Microsoft Word document that like Ryan opened for him on his computer. That's perfect. More of that energy.
Yes. Yeah, and this one, dude, I mean, again, your thoughts, your reaction.
Okay. I I don't with this person at all. These types of comments, because people already, even this week, they're like, do you regret it? Do you regret it and you want to go back? I'm like, I'm so good. I'm hopeful that we will never cross paths again, me and this
Mhm.
guy. Because I actually know a lot of him. That's part of the reason why I was like, this is not the place for me. I don't feel
Yep.
seen at this job. But what I love too is, and I respect to an extent, the dedication, because he was like, when you're too old to operate as an ENT, you can stay a primary care physician, which, like,
I
not for
guess.
me, but I mean, this man is married to the game. I respect that. I am getting married to a different game. I'm just gone. But, you know, I think that, like, specifically the in group surgeon takes, especially from this maybe generation, they just get increasingly disturbing. But yes, your thoughts.
Which is oh, oh so this guy. Um Once again, they take it as a personal affront when you make a different choice. And this speaks to, yeah, he's married to the game to a certain extent. Is he happy? Maybe, maybe not. But the whole deal, and this was my issue with growing up, as we all do in academic medicine, right? Growing up in academic medicine, you are never taught nor exposed to any other ways of utilizing your degree, your knowledge, your skill set, anything like that, right? Like even going into private practice is kind of looked down upon when you're in training, right? Like everyone's like,
Mm-hmm.
well, you got to be doing research. You got to be in a center. You got to
Mm-hmm.
be like going to conferences and like doing all that stuff. Like, no, you don't. You just don't. And if you go into private practice, you got your own set of issues out there,
Mm-hmm.
but nobody is telling you like, hey, you know, you could do this, go to clinic, go to OR for the rest of your life. Or, you know, there is a variety of ways that you could use your skill set and your knowledge and your passions, maybe the passions that have been stamped down and ridiculed during your training. You can use those and make a lane for yourself that is really fulfilling in a way that, you know, yeah, if you stayed in in like clinical surgical practice, would you have been a good doctor? Absolutely. You know, would you have made people's lives better? Absolutely. But you know what? Life is a I mean, life's about you. And that is a thing that not being able to recognize that is kind of an epidemic amongst, you know, doctors. You know, because we're trained in
Yeah.
this idea
Yeah.
that to do this is to be selfless, like without self, right?
Mm-hmm.
Like to give everything you can in service of someone else and leave yourself for last, or leave yourself for never. You know what I mean?
Right.
And that is why so many of them are miserable. That is why so many of us burn out, we quit, we kill ourselves. You know, like it's, you
Yeah.
know, that's why, because we let go of trying to take care of ourselves. And once we do start to take care of ourselves, those who felt they were never allowed to take care of themselves take very personal offense to that. And then you get this internet vitriol from, you know, senior citizens because they were never allowed to think about that sort of stuff. But if he was, he'd be singing a very different tune, I think. Because, like, can you take care of yourself while still working in medicine? Of course, you can figure out a
Mm-hmm.
way.
Of
But
course.
if you love other stuff, you can find a way to take your experiences and make something really awesome out of it, like which you are doing right now, which I'm doing right now. And it's the best. Would we go back? Absolutely not. You know, because we
Yeah, and
are,
not only go back, but then past operating age, stay a PCP, Tony.
yeah, I mean, I could think of
Miss me with that.
nothing worse. I mean, no, shout out to the PCPs doing the work. Okay, if that's what you want to be doing, you doing that work, that's fine. But if you're feeling like you have nothing else in your life other than to, once your hands don't work anymore, to go
Yeah,
non-surgical,
exactly. Because I agree
like
with you.
go
I love
fishing, bro.
PCPs. I'm just saying, I don't want to be married to the game in my 70s. I want to be married to the sea. I just want to sit by myself and look at the sea. That's what I was envisioning for myself. Not what this
Mm-hmm.
guy's talking about. He's like, there's another way. Be
Mm-hmm.
a PCP until you like drop dead in your office. I will also say, and this is relevant, I think, especially as people like cannot wrap their head around what I'm doing, like very publicly, even though people like you, many more people like you have done it. It's just that like I'm doing it publicly. Well, we lost my dad. He passed away of sudden cardiac arrest at 60 years old, completely unexpected.
Ugh.
Like, so you know, I may not have my 70s. I'm not going to hatch up some harebrained scheme where I'm a PCP into my 70s and 80s. Like, I just, there's a lot of signs that that's not guaranteed for me.
Mm.
It's guaranteed for none of us, but you know what I mean.
Yeah, man. There's no time not to try your very best to be as happy as you can.
Yeah. So, okay, this next one, this hits on a huge theme. We see it across many comments, but I just chose one at random. Yes, it's all about her and her professors who wasted their time on her. Taxpayers through Medicaid, Medicare who paid her salary through the university, and the person who didn't get the ENT spot she wasted. Okay,
Mm.
I will share my thoughts because, like, again,
Mm-hmm.
I've seen this in so many comments now. The professors who wasted their time on her. If you're talking about from ENT residency, please rest assured, sleep well at night, knowing that those professors didn't teach me. They didn't take any of their time to teach. So, like, I think that we can just call that a wash in terms of I did my duty and all of my work, and I received no formal education. The taxpayers. I don't even have anything nice to say about wasting taxpayer money today. It was not I. And then the person who didn't get the ENT spot she wasted. This is really crazy. Obviously, there is a lot we could get into tangentially about like the bottleneck, the shortage of specialty surgeons like ENTs, the fact that like AAO lobbies nationally to keep those spots really low on purpose so that they remain competitive. I mean, again, I do not accept any attempts from people to put that on me.
Hmm. Okay. Um, I mean, sorry to hear about like those that was your experience and your feelings about your professors coming up. Um, but that's real, and that was your experience. Um, I think as far as the taxpayer thing, let's just look at this objectively. Those are not wasted taxpayer dollars because they were taxpayer dollars that went towards you when you were working, saving people's lives. So that's where they go every day. Whether you're there or not, they support whoever's doing that work. So, dumb argument. Um, last one. What was the last thing you said?
And the person who didn't get the ENT spot she
The
wasted, which
person.
tons of
Okay.
people are
Okay.
like, you stole a medical school seat and then you stole an ENT residency. That's crazy because I earned it. But okay, go
Yes.
on.
Yeah. Okay. To those people who think in that way, I just this is a this is it sounds like this is coming from someone who's not in medicine. First of all, this sounds like stuff they've read about. And as far as stealing someone else's spot, right? So I want to take people back to how this process works. Okay, you decide that you want to be a doctor at the age of what?
Yeah,
What do you
16,
think?
18.
16, 18. You enter into medical school sometime around 21, 22, 23, right?
Mm-hmm.
Um, then you train for almost 10 years, right? Until you're
Mm-hmm.
out. Um, now, for anybody who is thinking that uh, Dr. Hardin entered into this duplicitously or with any sort of, false intentions, um, take a step back and remember that when we all start this journey, we are emotionally still teenagers. Okay, we're adolescents. And we're kind of jumping into this life that demands we grow up or seem like we're growing up almost immediately. But at 22 through 25, 26, come on, like we're still kids, right? Do we think we know what we want? Of course we do. We enter into medicine for the right reasons. We want to do that, but we don't know what the world is like. And so the deeper we get into it, the more we think, maybe, there's still a light at the end of this tunnel. I still do want to do this. I still do love this or love the idea of what I can do when I get out. Okay. And in that process, we apply to medical school. In that process, we apply to residency. We try our very hardest and we are going in for the right reasons. Um, but then when we get out, we're in our 30s, mid 30s, right? Um, some of our friends outside of medicine have been married and divorced by then. They're on their house, or they lost their career, or they have kids, or they don't have kids, like all that stuff. People have lived entire lives which um, involve quite a bit of evolution, don't they? You know, and so for us to not be allowed that grace to evolve, to finally grow up by the time 10 years has passed since we first made our one and only career decision. Um, to think we're not allowed to do that and that we should be penalized or that we stole someone's spot, that's ridiculous. And I think you need to look in the mirror of how life works, how you were when you were 21 and how you were in your mid 30s. If you haven't seen change and growth and evolution, that's a problem for you. Okay. And then Second thing, that was a long first thing. But second thing, um, oh God, I had a good second thing. I got caught up. I got caught up in the first thing.
No, it was
But
really good. It was really good, man.
oh man.
I
But
love it.
yeah,
We need
oh,
that
this is
soundbite
it.
of you
Yeah.
being like, look in the mirror, man.
Yeah, man. And also just like big thing, just like kind of what I was alluding to earlier. Um, the fact that you are choosing a different path does not mean that your training as an ENT was a waste and that it should have gone to somebody else. You would not be able to be doing what you're doing and advocating for what you're advocating right now if you had not gone through what you've gone through. And what you achieve now could very well inform the next generation of physicians and help them to feel less alone, help them to make much more emotionally informed decisions about what they want to do with their careers. And so, yeah, you didn't steal someone else's spot. They're lucky that they gave spots to us so that we could grow and be like, okay, you know what? How I'm going to make the world better
Hmm.
is in this new lane that not a lot of people can do, but I can. So I'm going to go for it.
Yeah. Oh, I love that. No experience is wasted. And again, like some people change the world from within clinical medicine and other doctors change it from outside. And like
Mhm.
both are great. So,
Yeah.
okay, our last but seriously the best one.
Okay.
She's a quitter and I would never let a quitter perform surgery on me or my loved ones. Okay. Yeah, exactly. This is my absolute favorite. I will tell you why. Because it's a non sequitur. I literally was like, oh, should I reply to this one? Because, like, by definition, a quitter would never perform surgery on you or your loved ones. So, marked safe from that. I'd like to hear your quick thoughts, and then I'll tell you the conversation actually continued. So, I need to come back to that. But
Now, I
what's your
was just
hot
about to
take?
say, how many of these did you actually respond to?
I didn't respond to any of these others, but like
Okay.
with this guy, I was
This
like,
one.
you are marked safe from that. Your biggest fear, which is that a quitter would perform surgery on you and your loved ones, like, well, I'm quitting. I'm not doing
Quitter.
surgery anymore. So, like, I did reply to that. I was like, all right, man, I can fix your problem. I'll fix it right now.
Oh my God. Okay. So, quitters. uh, you have no idea, good sir or madam, um, the fortitude that any of us in this world has. Okay. You have no idea the trials and the rejections and the failures that we go through just to keep this up. If we were to quit, knowing all that, you better be damn sure that we're quitting for reasons that are very important. Okay. Like, we had plenty of opportunities to quit because it was hard. And I think that's what you're
Mm-hmm.
trying to get at, is
Mm-hmm.
because I don't want someone who doesn't know how to work hard operating on me.
Yeah.
Listen, bro, like, or ma'am, I don't know who this is, whomever you may be, we had plenty of chances to quit. Okay. Some of us do, but if it was because things were hard, listen, we got the idea that you should quit because this is too hard beaten out of us for years.
Yeah.
Okay. Like, for years, while we were not sleeping and not eating right and drinking a lot of alcohol, like, we got it beaten out of us. Okay.
Mm-hmm.
So when we say it's time to go, we know it's not because this is hard. It's because we know there's got to be something better.
It's time. Yeah. Like, I mean,
Yeah.
I don't know any, like, surgeons are so serious. We take everything seriously. I am
Hmm.
not exempt from that. I'm a pretty serious person. So, like, I did treat this as life or death for me, which it ultimately
Yeah.
was. And I chose life.
Hmm.
Here's the best part, though. Okay.
Yeah.
So I'll read you some of the replies. There are 3 replies total. There's number 1, me saying, by definition, a quitter wouldn't be operating on them because they would have quit. It's a non sequitur. We have one person saying, at Vendetta, I think you missed the point of her post. We have another
Truth.
person saying, at Vendetta, you got that toxic vibe. But listen to
Who
this.
does? Oh, to them. Yeah.
Yeah,
Uh-huh.
yeah. And this is incredible though, because then minutes later, I get a notification.
Come back. Yeah.
Vendetta's back.
Oh,
Here's
yes.
what he said. My bad, fam. I'll reel it in a bit.
That's about it.
That was the highlight of my week. I was like, can people change? Can people learn and evolve? And like, I really appreciated that. That I like, all is forgiven. I have no beef with like Vendetta, whoever this guy
Vendetta,
is.
you are relinquished from beef. Though I don't believe you have changed, Vendetta. I think you were shamed in
I will
public.
take that. I will take them even because, one option is just like delete your comment and like fade into the bushes, like meme Simpson style. But like,
Hmm.
I'm not sure I've ever seen that. And I grew up on Reddit. And like, I'm not sure I've ever seen really like the just my bad fam, I'll reel it in. And I say this all the time in real life. I have to say this. I have to humble myself pretty routinely as a person who sometimes brings like a crazy or aggressive energy to the function. I sometimes say, hey, you're right. I'm going to take it down about 100 notches. I'll be back in a moment. I respect that move.
The energy to the function. That is, yes, I like that. That is that make I was gonna say that's a very black people comment. And I appreciate that. It just it's of the culture, and I love it. But yeah, well maybe, I want to give everybody the benefit of the doubt. Maybe Vendetta, after seeing the shame, maybe went back and listened to your whole thing, maybe gained some insight, Vendetta, and then brought that back to their own lives to reevaluate, how they're moving, in
It was
this
like 10
world.
minutes, Tony. So I don't know that a person undergoes that level of like introspection and reflection. But maybe.
Let's be clear. I don't think this happened to Vendetta,
Yeah.
but in a world where people do get better, maybe. Otherwise, Vendetta's, thumbs are hurting, sitting on the couch, hating on somebody else. Godspeed.
That's fine. Take it away from here. Like we're
We don't
fine.
need that energy right now.
Yes, exactly. So I loved that. Thank you for doing mean tweets with me. I'm sure that
Yeah.
there will be many occasions. It's been a bountiful harvest, Tony. So like we could do this all day.
We could go all day, but you know what? You know how correct your move was. Um, I applaud you for putting it out in public. I mean, a lot of this stuff, that's the whole thing with, your venture right now, like my, decision to become an author and put my dirty laundry out there and stuff like we don't heal unless we're honest on the biggest stages that we can attempt to be. Um, and I know that I'm sure there was a lot of love coming at you as well from this, and the haters, they've been miserable, like nothing you can do. But the number of people that you've probably, and I speak from experience here, number of people that you, in just doing that, and as you continue to live your life and do awesome stuff, number of people that you have freed to even consider the possibility of doing something different, whether it's in medicine, whether it's in whatever
Hmm.
walk of life they're coming from. Like you unlocked and like creaked that door open, and I would not be surprised if you start getting messages every now and then from folks who just want to talk about how you got to this decision, because in my last few years I've unwittingly become like the patron saint of the Dropout Club, and it is a position I am so happy to hold, because I've seen folks very close to me from my same residency call me up, and these are folks I would never think of in a million years, just as I'm sure they didn't think of for me, but they're just like, I gotta go, is that okay? I was like, of course it's okay. I know you don't come to this lightly. How you want to live your life? Let's talk about that. And
Yeah.
so just the mean tweets, they're short lived, dude. But the folks whose perspectives you changed, that's gonna be really meaningful, and that's gonna affect folks for a long time. So those are my closing words.
Yeah,
to
I
you?
told no, that's very sweet, and I totally agree. I mean, I have like 30 to 50 DMs now kind of to sort through at all times. And like, but it's a good problem to have. And what's crazy and what I would imagine that you've seen over the years is that these people who reach out where like there's something unsettled that makes them want more or want different,
Mm,
they are on the whole some of the most brilliant people I've talked to in a minute. Like these people
mhm,
coming out of the woodwork, they're lousy with talent. All the other stuff that they're doing, clearly how their mind works, how they present
mhm,
themselves to the world, it's crazy. It blows me away. I'm so happy to see it. This is what I was looking for when I left the hospital. When I see
mhm.
that amount of like sheer brilliance and talent, I think to myself, no wonder the hospital was too small for you.
Mm, that's real.
Okay, so our next segment for today, and all we have time for, is spooky ghost stories. And I'll set the scene. Medicine is the haunted house, and we're the ghosts.
Mm. Oh dear. Okay.
I just
Um, we are the Walking Dead. Uh, okay. So what I tell a spooky ghost story?
Yep, yep. And then I
Okay.
have like a two-line scary story from the hospital.
Okay. Um, so okay, you want a short,
No, you
scary.
can do like a longer one. Do you want me to do
Okay.
maybe my like 2 minute? Just be like, here's my like brief intro, and this is what I came up with for the spookiest thing I could
Oh no,
imagine.
I can just go in. I just didn't know how much time
Okay,
you had.
yeah,
But I don't like take a few minutes.
that's fine.
Um, so we'll set the scene. I'm not sure the extent to which I am the ghost in this, but
Oh, we can remove that then.
oh yeah,
But is that not such a good tagline? I just
I
like the
love it.
idea of it.
Yeah.
Like I do want people to feel haunted by us.
That's brilliant. Okay, take y'all back to intern year. I'm a baby doctor. I'm on the plastic surgery service, and I get called down to the emergency room for a lady. Chief complaint is something on my hand slash bug bite question mark. So I get down there and I'm just like, okay, cool. And when I walk in, I see like it's an old lady. She's very, very pleasantly demented. Okay. She's there with like a nurse who's not paying any attention to her. But this lady is just, she's seems fine. She's got her hand wrapped up like in like 6, 7 feet of gauze,
Mhm.
right? So I'm like, all right, let's see what's up. Like, she's pleasant. Like, let's see what's going on. Um, I can see that the ER had not yet looked at this hand. It
Oh.
was still wrapped from the nursing facility. So I start unwrapping, and I keep unwrapping and unwrapping and unwrapping. And, as I unwrap, it just starts to smell, right? It just starts
Ah.
to stink. And I am just like, I have no idea what I'm going to end up seeing. And I finally get to the bottom. And um, what's going on with her hand, it's not a bug bite that I can see. It's this enormous, it's like her hand's been stretched out, almost like there's a tennis ball that's been growing inside of her hand. Her skin is kind of stretched over on both sides. Some ball of something bad inside of her hand. I'm just like, okay, this is weird. And the top of the ball kind of has this open crater in it.
Hmm.
And I asked the nurse, like, "Hey, like, what y'all been doing with his hand here?"
Yeah.
Um, and she was like, "Oh, we just been wrapping it. It started to smell, so we had to wrap it in more stuff." And I was like, "You guys been putting anything in here?" Um, because it looks like there's rice inside this crater in this hand. And she's like, well, I don't know what you're talking about. And goes back to reading her magazine. And I look down and like, there's rice in his hand. And then I start listening and I just start hearing this like little like snap, crackle, pop, like Rice Krispies. And it's soft. And I'm like, what is that? And then I realize that the pieces of rice in her hand are moving and they're sliding over each other and crawling in and out of the hole because the rice were maggots and they were very much alive and eating whatever was left of her hand. And Tony has never seen maggots in his life. This is my first time. And I see this, and, panic rises, and I start to, begin the vomiting process, right? But the whole thing is like, you're a doctor. You can't seem like you haven't seen this before. You also can't throw up on the
Yeah.
patient.
No.
So
You
I'm
lose
just
style
like,
points for
I
that.
just start wrapping this hand back up as quickly as I possibly can as I feel the chunks like rising, right? And I'm going because I was like, I gotta get out of this room before I just vomit all over this poor old lady. So I'm rapping, and the puke comes up. And all of us know that when you vomit, like, you're always surprised by like the velocity, right? So I'm just like holding with all of my might, like just the pressure in my lips because my mouth is like full of vomit. And you feel it kind of trying to creep up to your nose. And I'm just like, get me out of here. And as I'm wrapping up, she's talking to me, my eyes are watering, and I'm like, cool. It was only one big heave, but now I got to swallow
No.
because I got to get out of here and I have to keep up appearances. So I swallow the puke as the maggots are wrapped up,
You're
and
kidding me,
I
puke,
walk out,
honestly.
and then I go to the bathroom and I rinse my mouth. I don't have any toothpaste. So I just continue the rest of my shift with a bit of puke mouth and the feeling of maggots crawling all over me. So that's as spooky as I can manage. The end.
Wow. Tony, that exceeded expectations in terms of spooky stories from the hospital. It's also like the most intern. It's like the classic intern.
It's
story.
highly
Like,
intern, that story. Oh my gosh.
Just swallow your vomit and just like move on. Just like see the next patient.
Keep
No one
it moving.
cares. Just like, I mean, who took out the maggots? Did you call
I didn't
an
take out the
adult
maggots.
to come?
Everyone said, when I told my upper level residents, and they were like, okay, for now, don't touch the maggots because they are eating the
Helping.
dead tissue.
Yeah.
They're doing the work. They had the imaging, all this stuff. So it was a cancer in her hand.
Yeah.
And what had to happen was she needed her hand amputated. And so that's eventually what happened. I did not do that, but they told me to leave the maggots.
Well, honestly, I think that they liked you then, because I will tell you, I've seen several of these. Like, it happens all the time with squamous cell carcinoma, metastasized to the lymph nodes that eats out to the skin. Like, we see those with maggots. That comes into the ED. Like, I've seen that more times than I wish I had seen it. And they always were like, pick them out. And you just have to pick them out. But now hearing your story, I'm kind of like, I low key just think that like the seniors were just like kind of being jerks about it, because they were like, sit in the emergency room and like pick every maggot out that you can find. And what's so funny about them is that you wouldn't have experienced this, hopefully, but when you grab them with a pickup and you put them in a container, you have to have like a med student or an assistant holding the
Keep
container
it shut.
Yeah, exactly.
Yeah.
If they try to escape, they'll just jump right back out. Now you
Honestly,
have maggot pants.
I mean, I haven't. I'm admittedly not as well versed in maggot situations as I once was, but personally, I think the request to take out the maggots is more of a biohazard issue for the hospital. They just don't want flies in the hospital, so they want you to like get rid of them. But I don't think they're not. I mean, for the situation, until you get in the OR, you do whatever it is you got to do. Like, it doesn't honestly matter. But
wow,
that's me. I don't know. I've been trying to like block that out of my
Yeah,
memory
gross.
for over a decade now. Jesus.
Wow. Well, thank you so much for rustling that up to horrify and disgust all of us. Like,
Yes, you're welcome.
I was like, should I just mute you for like that segment of it? I was like, I already see I don't want to hear where the story goes. Like, I could just mute you and then at the end come in and be like, wow, that was crazy. Okay, here's my story. I heard it though. I heard the whole thing. It's so funny because I also prepared like my little spooky story, and we'll get into it.
Yeah.
I am a PGY2, a junior resident. It's 3 in the morning. I'm on call. That's junior call. I'm post call. So, maybe a couple hours of sleep, running on less than an hour of sleep. And the pager goes off. It is the emergency room.
Mm-hmm.
Not unlike Tony's setup here, although I'm not an intern anymore. I'm a PGY2, but like a new PGY2. It's the ED, and it's like foreign body in the ear. Okay.
Nice.
So I go down there, and I'm like, what's going on? And they're like, yeah, a cockroach climbed in their ear while they were sleeping. They woke up because it was hurting. Okay, and the ED is telling me we followed protocol on this. Guys, I need everyone to know the protocol is when a bug comes in the ear like that, it's for the emergency room to drown it, usually in lidocaine. So drown it, and then like maybe make your best effort at removing it. Here's what the result of that is. By the time ENT is called, and like me, a person who does not with a bug in any situation, like really not. I'm the person who, like, if there was a spider in my dorm room in college, when I was living in a single, I would just go out into the hallway. I would just kind of mark where the spider was, and I'd go stand in the hallway until passerby, strangers, I'd be like, hey, you afraid of spiders? And they'd be like, who are you? And I'd be like, will you come get this? And that's how bad it is with me and bugs. So in the ENT showing up on junior call here, you look in the ear, and when you look in the ear, especially under the microscope, which is what I had to do, to get it out, it is a just cockroach limb soup. Like it's literally, it's all this stuff floating in the lidocaine, and then it's been dismembered by the emergency room. So literally, like
they were trying their best.
I know, it just I don't know if it's better or worse for it to be in one piece. Like I honestly don't know. Maybe it's better for it to be in pieces, because that way I can pretend like this wasn't a guy like an hour ago. Like I don't know. But it's literally like hairy leg by hairy leg, and then you get the eyeballs. The torso always comes separate. Like one wing will always be stuck on the TM. It's like, anyway, that's my spooky story.
Gross, and relatable, because I remember my first cockroach in the ear.
You never forget your first cockroach.
You never forget your first cockroach in the ear. Mine was a kid who went to a slumber party at a kid's house who I'm sure she never went to slumber again. Yeah. But yeah, I remember it came out in several pieces. Just I may still have I'm less grossed out by bugs than you are. I probably still have the photos on my phone of the bug pieces on, like, once I took it out, because I was actually kind of jazzed up about that. But it was no, I'm not okay. I'm not a normal person, so yeah.
That's pretty different from me. I literally was like, who am I going to call? I mean, there isn't really a corollary to that, other than that, like, at other points, even as a junior, I think when I was a 3, same thing. There was like a bug ear, but it just happened like during normal working hours. And I just literally like called my co-resident. I was like, hey, how much cash would I have to pay you to just like come do this consult? Like I'll do the note and stuff. Like I saw the patient, I will do the note. I don't want to touch this bug.
That's not why you got in the game.
No.
It was not for cockroaches.
Well, it's so funny because that old advice of like, what specialty do you want to do in medicine? Pick the bodily fluids that you tolerate. I literally was like, ENT, I am okay with all manner of earwax, nasal snot, oral secretions, and trach secretions. Like, I mean, I'm not like, oh, give me more of all of those, but I'm saying I don't get too worked up. None of that stuff bothers me. Had even one person been like, what about cockroach ear? I think that could have plausibly, we wouldn't even be here today. Yeah, I would be living my best life, as an international pop star or whatever. That alone would have set me down a different path, because I was like, oh, I don't want poop. I don't want to look at another diabetic foot or like a panis yeast infection. I think all those things used to be very off-putting to me.
Well, I think now, whenever anybody asks why you made the move that you just did, just show them some cockroach pieces. Maybe you should put like dead cockroach pieces like on your merch and just be like, I mean, that's it. I don't need to explain anything to you guys.
Yeah,
This
like,
is where I'm at.
does somebody want this job? Do you want this
This
job?
was my job. Like, you're welcome to it. Gross.
Well, I loved getting to connect with you today, Tony. As expected, as I said, I feel like this literally helped heal me after such a crazy week. I love your ghost stories. I feel like we could keep trading like war stories from the hospital for sure, but
Hmm.
there's a lot of time for all of that to come. You're just truly, like I said, I think one of the iconic physicians out there in the non-clinical work, just doing your thing. Um, you remind all of us that there is life after medicine, because even if people can't look to me, like, it's still pretty fresh. I still worked at the hospital like 3 weeks ago, so this is fresh, but people can look to you as like, you did it. You're living your best life.
Yeah, just doing my very best, and just happy to see other folks, you know, pursuing their joy and happiness, making the world better in the way that only they can. So, in that vein, I'm very, very proud of you, and I'm so excited for everything that's to come.
Thank you so much. Thank you for tuning in to this episode of Surgeon Interrupted. We will be here every Tuesday. Same time, same trauma. If you liked this episode, rate, review, and don't forget to scream into the void. Or just share it on Instagram, whichever you prefer. Connect with me on Instagram or TikTok at Frances Mei MD, or visit us at our website, hippocratic-collective.com.